Very good afternoon to all the viewers from Global Hospitals, Parel, Mumbai. Myself, Dr. Pushkar Mehta, would like to welcome you to a Facebook Live session today afternoon. A topic of interest as well as closeness to all the viewers as well as a lot of patients. If you are a human, this topic makes sense for you. It is that important for you to understand, and a very special person and a doctor with us here today. A very good afternoon to you, Dr. Nilesh Sadbhai. Dr. Nilesh Sadbhai is head of Department of Plastic Hand and Reconstructive Microsurgery and Hand Transplant at Global Hospitals, Mumbai. We thank you at the onset of this session for spending your valuable time with us here today and helping us understand on a topic that is wounds must heal, the expert talk. To take the session ahead, my first question to Dr. Sadbhai is what are wounds? What are types of wounds? And how do you assess the severity of these wounds?
Yeah, thank you very much, Pushkar. A very good afternoon and warm welcome to all our viewers. Yes, as Pushkar rightly said, that wounds are a very important aspect of medical and surgical treatment, and we need to do and know all the right things about how to take care of our wounds and how to ensure that they heal properly and in time. So, in a broad perspective, all wounds could be classified or differentiated into acute wounds and chronic wounds. So, by acute wounds, we mean that wounds that happen in a short duration of time, or they are not too old. So, majority of the acute wounds mainly happen due to trauma or injuries, or often due to surgical assault of some way, and or due to burns. Similarly, chronic wounds are those which either don't heal in time or which heal and recur for some reason. So, chronic wounds are the main burden of our healthcare, because many patients we find they have wounds which have not healed for months together or sometimes even years together, and this has a huge impact on their quality of life, and it also adversely affects their family life, their vocational capacity, and it also is a burden on their caretakers, as well as it adds an enormous amount of cost to the treatment and to the healthcare system in general. Hence, it is very important that we take care of both acute and chronic wounds to ensure that they heal in time.
Okay. At the same time, as you have differentiated the wounds into acute and chronic, how is the wound healing process for these types of wounds?
Yes. So for the body has a very beautiful reparative system. So after any injury, the body mechanism is in process and it tends to align the structures together. It tends to heal them together. It tends to form a scar at the injured site. So all tissues in our body essentially heal by scarring. And this scarring, of course, is dependent on several other factors, and plus the blood circulation to that area is the most critical determinant of how soon or how good the wound is going to heal. So the blood vessels, they regenerate and they grow into the area, and they cause the wound to heal and become strong with time. Now, in an acute system, this mechanism is pretty much streamlined, and the wound usually heals within 10 days to 2 weeks of any injury or surgery, or even superficial burns. But yes, if a wound has not healed within that time, then surely there are some factors which we need to look at. Either some factors are missed out, or some factors are neglected, or some factors are not being taken care of appropriately. So typically in chronic wounds, the major culprit in all the chronic wounds is diabetes mellitus. So diabetes, as we know, is a silent killer, and India, unfortunately, is the diabetes capital of the world. So diabetes is one of the most important factor which complicates wounds. In addition, there are certain other diseases and disorders which lead to delay in wound healing. such as varicose veins, lymphedema or filariasis, the pressure sores or bed sores that, as we commonly know, which happen in patients who are either paraplegic or they are bedridden for some reason and they are unable to take care of themselves. And as a result, the pressure sores develop. In addition, burns of higher degrees or deeper burns are known for their chronicity. In addition, some other types of injuries such as chemical burns, radiation burns, or cancer for that matter also can lead to ulcers and wounds which don't heal in time.
Okay. With this understanding of the healing process and it being a natural process of our body and a reaction to every wound that our body has, where does the role of plastic surgeons such as yourself come into the picture?
Yes, so plastic surgery, as we have discussed earlier as well, it is a problem-solving specialty, and plastic surgery per se, as we know, does not deal with any particular body system. So it deals with any and every problem that all the other medical specialties face. So plastic surgery is basically based on some certain set of principles which need to be applied in every situation, and that is what helps in solving the problems which either have failed to cure or they are difficult problems to begin with. So plastic surgery aims to look at all these aspects which lead to delayed wound healing or which inherently make the wound too complex to be managed by simpler measures. So, as a plastic surgeon, we deal with wounds of different types and different etiologies, and we take care of the problem factors and we take the measures which are essential for the wounds to heal. So, in a broader perspective, coming to look at it, all the wounds are actually very simple to treat. I say that because every wound has a causative factor, it has a complicating factor, and uh, considering the general health of the patient and the general condition of the limb or the wounded area, we get an idea of what needs to be done to that severity and depth of the wound. So practically, it is all about putting all the blocks together and solving the jigsaw puzzle. But however, when it comes up to the actual treatment, we still have several factors. Such as, just as I mentioned, the diabetes is a major culprit for delayed wound healing. But yes, diabetics also might have a heart disease. They might also have a kidney disease, which will further complicate their nutritional status, their healing capacities, the other factors which play a role in wound healing. So all these factors actually make wound healing a tough task, and hence we need to have a person to lead and think in a broader perspective and to coordinate in all these multidisciplinary experts to ensure that the patient is optimized and the wound heals.
Okay. With as you've mentioned, that diabetes mellitus itself can be a hindrance to wound healing process. Is age also a hindrance to wound healing process?
Yes. So, yes, with age, what happens is that the tissues, due to the wear and tear and due to the metabolic changes that happen in the body, due to the changes that happen in your lipid profile or the atherosclerosis that happens with time, the blood vessels, they tend to lose their elasticity. They tend to get clogged or blocked with uh, atherosclerosis or cholesterol. So all these factors eventually lead to gradual decrease in the blood supply to your extremities. So the body has a mechanism in which it knows how to prioritize which organs. So the critical organs such as the brain, heart, liver, kidney, all these are identified and known by our brain and its sensors that these are vital organs, and the blood circulation to these organs need to be preserved in any situation and at any cost. So limbs naturally are a lesser priority for the brain. So in any situation, when the blood circulation is compromised, or a person suddenly loses blood or is in a condition of shock, it first thing that happens is it constriction of the blood vessels of the periphery. So it cuts down the blood supply to the limbs in order to divert it to the more vital organs. So that is what happens even with age. The blood vessels of in the lower limb typically tend to get thicker and blocked, and the blood circulation to the feet tends to reduce. And plus, with our regular activities and wear and tear, the feet are exposed to a lot of shear and stress in all our day-to-day activities, and that is what makes the care of the feet very important, even in a normal individual, and more so in a diabetic person, because the beginning of an ulcer or an injury on the foot is like an it is like the tip of an iceberg. So because in diabetes, another problem is that the sensations to the feet tend to reduce, because the nerves they tend to get numb with time. So the protective response or reflex that is associated with the pain is lost. So a person may have a stone in his shoe, but he may still not sense it because he has decreased sensations. He might be he might develop a cut by a sharp object, but he'll not feel it. He might be walking on a hot surface, but he will not sense it. So all these factors make the diabetic foot very vulnerable to injuries, and the beginning of an ulcer is an indicator of a much severe problem probably inside, and it needs a very urgent attention, because every ulcer which progresses to gangrene or necrosis is it may land up in amputation of one or more toes, eventually the leg or the limb, and then eventually the life. Because in every person undergoing a lower limb amputation, the mortality rates or the 5-year survival rates are surprisingly low. So it is really a matter of big concern.
Okay. Has COVID made any difference to the wound healing or wound related complications?
Yes, since the time this pandemic has begun, we have seen really bad and shocking cases. As we have seen that the virus has a thrombogenic potential, so it leads to development of clots in the blood circulation or the blood system. And we have seen several patients in the last 1 year who have developed extensive clotting in the blood vessels of the either the upper limb or the lower limb, and that has resulted in gangrene of these limbs, and eventually we are left with no other position than to amputate those limbs, because the life is at stake, and there are even more important issues that need to get priority. So limb salvage has not been ideally possible in these patients. So COVID has led to these thrombogenic complications happening. Plus, on the other hand, because in order to avoid these complications, these patients are on blood thinners. So we have also seen some cases in whom the coagulation system is not perfect. They have developed bleeding complications. So we also have encountered blood clots or hematomas in some patients, which had to be dealt with. But of course, a bleeding complication is still acceptable, and because the limb is still salvageable, rather than the thrombotic complications which have led to limb loss.
Okay. Now, as a general audience with some understanding of what wound is, what wound healing is, and the different types associated with it, what are the newer modalities that are available today in the treatment of wound care?
Yes, so there are several modalities and options. So it is like any other field. Unfortunately, even in medical field, there is a lot of advertisement and marketing gimmicks happening. So every 6 months, we see new gadgets, we see new medicines, we see new creams which are coming on the horizon, and they tend to lure the patients for their problems. That is because these problems are chronic, and the patients are actually desperately looking for options and solutions. But yes, I usually stick to my basics. So I believe that certain basic things, if they are taken care of, can be of much help rather than falling prey to fancy things and which are of questionable value or of unproven evidence. So, taking regular care of feet, uh, checking for injuries, moisturizing the feet well, using a proper footwear, getting a regular checkup done, uh, are are the best possible things which can help in development of ulcers and wounds in the feet. And meeting a specialist at the right time, because many a times we find this fear in the common man. Undergoing a surgery is a big no for many of them. But what I feel is, if a surgery is going to heal a wound in a short time, say 10 days or 2 weeks, rather than undergoing dressings months after months and spending and wasting a lot of time and effort on these conservative measures, undergoing a surgery and healing the wound early not only saves you time, but it also ensures that there are no long term complications or secondary infections. And it also is cost effective in terms of the time and effort of the family members and the caretakers and the patient himself, who can be back to his work at the earliest. Having said that, we do use certain gadgets or equipments as adjunctive measures for wound care. The most common of these days that we use is a negative pressure wound therapy. So this is a really convenient technique or method in which, for wounds which are not really healthy or they are going to take some time to improve and be ready for surgery, a special kind of dressing is applied to the wound, which helps in cleaning or for the wound to contract in size and to get more red or pink granulation on the wound, so that the wound is ready for grafting or wound cover. So negative pressure wound therapy is a real boon for wound care. uh, Besides that, we often use hyperbaric oxygen therapy. This is again is based on high pressure oxygen uh, being delivered to the patient in a closed environment to increase or improve the oxygenation of his blood. So as I said, as the blood circulation reduces with age, or the blood vessels they get constricted or blocked, the oxygen tension that is reaching the tip of your toes is decreasing. So hyperbaric oxygen therapy increases this oxygen concentration in the blood, and it gives the wound a better chance to heal. So hyperbaric oxygen therapy also can be limb saving at times and is an useful adjunctive measure. Along with it, these days we are getting newer lasers, which are also proving to be helpful in improving the wound condition to some extent. Of course, they need supervised treatment, and they do need surgical interventions at the right time. You cannot really avoid surgery when it is indicated. So I believe that if on day one a wound needs a surgery, it will always need surgery, or surgery is always the best option for that wound. So coming to terms with it and accepting this fact actually is helpful in saving a lot of time and money.
Uh, Before we move to the next set of questions of the session, would you like to share your screen, few pictures and slides related to what we have discussed till now?
Yeah, I'll just go through some examples
Yeah.
so that we get an visual idea of what I've been discussing all this while. Yeah, are you seeing my screen now?
Yes.
Fine. So, as I said, that there is no wound. So, there is a common term in surgery, which is famously called as a non-healing ulcer. And I firmly believe that there is no ulcer which is non-healing, and all ulcers must heal. So, they must get the right attention they must get the right care at the right time. And I'm sure that all ulcers can definitely heal. So, as we discussed, plastic surgery is a process of reconstructing and repairing parts of the body by transfer of tissue, either in the treatment of injury or for cosmetic reasons. So this I say because it has a huge impact on the quality of life of individuals. Wound care is basically about the quality of life because a patient with a wound definitely has a compromised quality of life, as I explained earlier. So these are certain examples of what we have seen in the last 1 year. These are complications and thrombosis in the major circulation that has happened due to COVID-19 infections. And this has led to gangrene of hands and feet and toes. And these patients, unfortunately, had to undergo amputation at that suitable level, as the limbs were not salvageable beyond that. So, treating of wounds is based on certain basic principles. As I said, plastic surgery is a set of principles, and we follow a logical sequence of thought and deal with the problems accordingly. So, with the reconstructive ladder, we mean the different treatment options that are available to heal different wounds depending on their complexity. So, as the wound starts getting more and more complex, we have other complicated treatment options which can help in those healings. Now, as the time and experience and skill of the surgeons improved, this ladder turned into an elevator, and then we could jump on any stage at any time in order to customize the treatment as per the patient's need and demand. As time progressed, plastic surgery is now at this stage. It is in a reconstruction supermarket. So you can actually customize the treatment depending on the exact needs of the patients, and you can be extremely versatile in offering the treatment options to different patients. So the thought process behind any wound care or wound cover actually depends on assessment of the wound thoroughly. So that can differentiate the wound into two parts. One is a critical part and one is a non-critical part. By critical part, I mean that the critical structures in the wound, such as the bone, tendon, nerve, blood vessel, if any of these structures is exposed, then the defect is said to be a critical defect. Or if the wound is just muscle and flesh, or which is covered with good, nice red or pink granulation tissue, then it is a non-critical wound and it can be treated by simpler measures. So we'll go through some examples. This is a child who met with an unfortunate accident, and she had a huge degloving injury on the entire leg. She didn't have any fractures, but yes, and the skin was peeled off and the wounds were badly contaminated. So we did a thorough debridement and cleaning of these wounds on day one, which actually made the wound healing environment very stable, and that led to rapid healing of the wounds. So these wounds were so bad, they were contaminated, but the cleaning of the wounds on day one actually determines how smoothly these wounds are going to heal. So after the cleaning and debridement, everything was done. We see that the wounds are now nicely red and granulating, and they are simple wounds which can be treated with simple skin grafts rather than any other complex procedure. So we just did a simple skin grafting on these wounds, and all these wounds went on to heal in time. So this again reinforces my point earlier that doing a surgery at the right time actually saves time rather than being afraid of surgery and delaying the uh, treatment and healing of the wounds. This is another case which was a neglected case of multiple fractures, which was treated outside, and the patient was then referred as the wound had not healed for 3 months. So with so much of wires and hardware, the wound you see is very pale and dirty looking, and the blood circulation also is compromised to some extent. So these wound again was cleaned thoroughly and debrided. You see now the wound is much cleaner. This pocket or sinus is due to the bone infection that the patient had developed, that again settled with some time. And then again, as this wound was simple and granulating, it was skin grafted, as the weight bearing areas of the foot were normal. So this wound again went on to heal with a simple skin grafting. Now, this is another defect in which the patient had an injury on the pulp. This is a deep defect. Now, whenever you're treating, now this is a critical defect as the bone is exposed to some extent, and this is a functional part of the hand. So you need the patient to have a normal finger pulp in order to be able to function normally. So this patient underwent a thenar flap. So the flap is taken on the thinner part of the skin. The finger is attached to that thinner area, and then the tissue on the thinner area of the hand is now transferred to the fingertip. So this reconstructed the finger to a reasonable extent, giving the finger a good cosmetic appearance and also the bulk of the pulp tissue that was lost following the injury. So this is the follow-up at 3 weeks. The wound is well settled. The finger is pretty decent looking in shape and size and contour. And this is after 15 months. He has a well settled finger, well settled scars, and the finger he's functioning to his full capacity. This was another bad injury in a worker who lost the fingertips of all the four fingers. Again, these are at very sensitive and tactile areas of our hand. So reconstructing the shape of the fingers and the giving him a painless grip is extremely essential for him to be able to work and function normally. So this is the wound on the other side. So in this case, again, we did a multiple cross finger flaps to cover the fingertips. So you see the flaps are taken from the dorsum of the other three fingers. These flaps are now connected to the fingertips to transfer the tissue from the dorsal side to the finger pulp. Now, after division of the flaps, you see that the fingertips are now covered with skin which was originally belonging to the dorsal side of the finger. So these fingers are now safe and secured, and the length of the finger is maintained, the shape of the finger is maintained, and the hand is back to its full function. So this could save the hand and restore the working capacity of the patient. This was another bike accident in which there was a major injury and there was a big wound with resultant loss of soft tissue as well as bone. So the thumb is totally flail because of the lack of support, as there is no bone and the skin over the entire thumb is lost. These wounds were cleaned on day one thoroughly. All the contamination was removed. Then a flap was taken from the leg. So this is a medial sural artery perforator flap, and this bone here, you see a piece of bone was replaced. This bone was taken from the hip. The bone was replaced and fixed to restore the stability of the thumb, and then the flap which was taken from the calf was applied on top of it, and the blood vessels here were connected to the blood vessels in the hand. So you have reconstructed the thumb by replacing the skin and replacing the bone. So this is a composite reconstruction in order to restore function. As we discussed, pressure sores typically in old age or in debilitated patients, they develop wounds over the pressure areas which are unlikely to heal unless they have full thickness flaps or full thickness padding over those bony areas. So this was a chronic pressure sore. So these are the two flaps which are taken from the adjoining areas on the buttock, and then these flaps are advanced towards the center to cover the wound, and then the entire wound is sutured and closed. So these flaps now, because they are of full normal thickness, they will provide the required cushioning to that area and prevent or decrease the chances of that wound breaking down again. This is another problem that we often commonly see in post bypass, that patients who undergo cardiac bypass, they have a big wound on their sternum, and this wound can get infected at times, develop osteomyelitis. These patients often are quite depressed or unhappy because they have already undergone a major bypass surgery and then they have landed up with this problem. But yes, this problem needs surgery on day one, and it always needs surgery. So there is no shortcut to it. We need to take muscles on both the sides of the chest in order to cover the infected bone and fill up this gap and cavity. And then this flaps actually are now nicely sitting over the infected area and covering the infected bone, and the wound can be closed primarily. So this is the last case I'll go through. This is a chronic ulcer. Now, by chronic, as I said, they usually label these ulcers as non-healing ulcers. So this ulcer was on the toe of this lady for the last 10 to 12 years, and it would break down intermittently like this. She was on home care. She was washing it, cleaning it, dressing it herself at home. And imagine the morbidity that she must have faced over the for more than a decade. Now, this wound was unlikely to heal by simple measures. So, what it needed was to clean up the wound thoroughly. Now, this incision on top of the toe, because it needs to be replaced with healthy skin and tissue to cover the exposed bone and tendon in this area. So, this cut is made to identify the blood vessels in this area and to clean the wound. Now, what I did in this case was a thenar flap. So, a piece of skin was taken from the thenar area along with its blood vessels. This is the flap which is harvested along with the blood vessels. Now, this flap is now here at the wound site. The flap is now placed on the wound to cover the wound, and these blood vessels of the flap are now connected to the blood vessels in the foot. So, the blood circulation to this piece of skin is now restored by these anastomosis, and then this piece of skin is now expected to survive based on the blood that is receiving from the foot blood vessels. So this is the healed wound after 3 weeks, and finally, this ulcer, which was labeled as a non-healing ulcer, had healed after more than 11 years. So it is important that to keep this treatment simple, but at the same time, making it more aesthetic as well as functional, so that the patients accept the wounds and take care of their feet further and prevent their recurrences. Thank you.
Before closure of the session, we'll just take one important question, and that relates to post amputation rehabilitation, or post limb loss, the role of plastic surgery that plays in this. So, what are your experiences, suggestions on limb loss and amputation?
Yes. So, especially for lower limb amputations, lower limb, so there is a basic difference in lower limb and upper limb amputation. So, because the lower limb, the demands of the feet are limited in terms of weight bearing and walking, right? So, lower limb amputees are often rehabilitated with artificial limbs or prostheses alone, because there are several advanced and very good processes available these days for the lower limb, and hence these patients can do almost everything. Practically, we have seen bilateral amputees who have summited Everest, and who have run marathons. So for the lower limb, a prosthesis is definitely the a better alternative. But for the upper limb, the function of the upper limb is way too complex for any prosthesis to be able to provide that. So prosthesis does have its limitations for upper limb, and in an upper limb amputation, especially bilateral, transplant probably is the only wise solution available. For unilateral amputees, it is still a dilemma. It depends on the age of the patient and his mental capability to adjust and cope up with his disability. So that is a subjective decision for unilateral upper limb amputees. But for bilateral amputees, the decision making is much easier and clear.
Hmm. I think that broadly answers our questions. To conclude, I must say that plastic surgeons such as yourself are magicians to see the entire recovery from what the injury is. So, thank you for spending your valuable time here. Thank you for sharing your experiences and cases. Knowledge always enlightens, and I'm sure today a lot of viewers have been enlightened with the kind of knowledge you have shared with us today. Thank you, Dr. Nilesh Sadbhai, for joining us here on Facebook Live. To all the viewers, you can share this video. We'll be uploading this video on YouTube, so you can watch this video later on YouTube as well. Keep commenting your questions. We'll ensure they're answered. Stay tuned to Global Hospitals. Thank you. Thanks a lot.
Thank you. Thank you.